well, let's turn now to coronavirus. Cases are now at record highs ahead of the election. So let's bring on Dr. Taison Bell, Assistant Professor of Medicine in the Infectious Disease and Pulmonary Divisions at the University of Virginia. Dr. Bell, so there seems to be some back and forth on whether we are in the midst of a second wave or not. I had one doctor tell me, yes, we are absolutely in the middle of it. Another doctor yesterday said, no, we are not. I'm wondering if that distinction even matters as we go forward in the next couple of months with winter coming.
Well, thanks for having me on, Kristen. And yes, I think you're spot on. I'm not really interested in calling this a first wave or a second wave. I personally think we did not actually control the first wave. But regardless of what you want to call it, our cases are up and frighteningly high. And this is exactly what public health officials and infectious disease doctors were afraid of when we saw the virus persisting despite the warmer summer months. We were afraid that we would have a launch of cases going into cold and flu season. Cases are now up 50% compared to this time or the earlier part of this month. Our testing has only gone up by 13%. So those who say that the increased cases are explained by testing, that's not true at all. We're having more cases growing faster than testing. Our percent positivity in some states is frighteningly high. We want it below at least 10%, but ideally below 5%. But in states like Wyoming, 55% of their cases or tests are positive. In South Dakota, 46%. Even more populous states like Wisconsin, 27%, where there's a really rough outbreak going on right now. So, regardless of what you want to call it, it's here and it's surging.
So, doctor, wondering, I know that you just mentioned, right, that the winter months are coming, which is a huge cause of concern, especially as we're now going to be seeing the flu in addition to coronavirus. What is your biggest concerns over the next several months? Is it just that the daily case count number or the overall case count number is going to be increasing? Are there concerns about hospital capacity, or is this just all of the above?
All of the above and more. We're definitely concerned about our testing capacity. It is very hard to distinguish, actually impossible to distinguish patients who have flu versus the coronavirus versus the other respiratory illnesses that we have in the winter that all surge. So our testing capacity needs to be way greater than where it is right now. In addition, we've seen how cases can overrun hospital systems and have capacity reached in ICUs or exceeded. In some cases, patients being transferred out of the state to get care because there aren't enough resources to take care of these patients. And along with that goes our PPE supply, the health of our staff and our employees who work in these hospitals, because cold and flu season affects us too. And where before we would really just come into the hospital with the sniffles, or if we had a cough, as long as we didn't have a fever, anything's going to have to be considered a coronavirus until proven otherwise. So I do think there's going to be a lot of staff outages as well as capacity reached and maybe strains on testing in some areas of the country.
So asking you to pull out your crystal ball for just a moment. We've been seeing this spike around the country. We have seen some cities, some towns decide to impose some sort of lockdown. Newark, New Jersey, El Paso, Texas are two examples. But the appetite for broader restrictions, I think right now is fairly low for most folks, especially as coronavirus fatigue continues to drag on. So if we stay as we are right now, people are still, going to restaurants. I've seen people go to bars. I've seen some people on Instagram, for example, out there having parties, maskless. The rallies right now are going on. What do you think is going to be happening to that case count? How much higher do you think it could go? Really, I'm trying to figure out how bad it could get here over the next couple of weeks and months.
Well, I don't have a specific projection, but we've seen this play out before. And when we have cases going up and we're not implementing these public health measures and lockdowns that we need to, cases are just going to keep rising and eventually hospitalizations will increase. We're already seeing that in several states and across the country. And then eventually deaths will start to rise too. And that's when people will start self-imposing restrictions and not going out and not participating in the economy. So this argument that we either have to choose public health or the economy is a false argument because I really think they're partners together. I think we can have some of these activities that we're doing with some restrictions in place when we see cases surging, but it has to be paired with smart public health practices, wearing a mask at all times, especially indoors, spatial distancing, 6 feet at least, and frequent hand hygiene, and trying to avoid enclosed spaces. We absolutely have to do these measures now, or we're going to have bad news in the next couple of weeks.
All right. Well, unfortunately, we will have to leave that there. We'll have to bring you on again in the future to chat about this. Dr. Taison Bell, Assistant Professor of Medicine in the Infectious Disease and Pulmonary Divisions at the University of Virginia. Thank you so much for joining us today.